My armamentarium is my PPE, my probe, the neighbor's probe if needed, and the dental mirror and floss. Today we'll be using the marquee probe or the color-coded probe. It is divided into by 3 millimeter markings up to 12 millimeters in depth. The functions of the probe are to assess the health of the periodontium. It measures the clinical attachment loss, recession, width of attachment, the size of intra and extraoral lesions, determine bleeding areas, mucogingival relationships, and monitor the response of the periodontium to treatment. Before using the probe, I'll ask the patient about any history of periodontal treatment or if they have any concerns with their gum tissue. Here, I'm just checking for recession and marking any notes. To determine recession, you'll take the probe and measure the distance from the gingival margin to the CEJ. Any recession of more than 1 millimeter should be recorded. Next, I'll be determining the frenal involvement. So I'll just be pulling the skin back and feeling for any abnormal muscle pulling or a short frenum, seeing the gingiva, and it looked like it was within normal limits on both maxillary and mandibular. Next, I'm going to be measuring the width of attachment. To do this, I'll take the probe and place it on the gums and measure the distance from the gingival margin to the mucogingival line. That is about a 9. Next, I'm going to take the probe and insert it and measure down to the sulcus, and that's about 6. So then I will take these measurements, subtract 6 from 9, and the width of attachment is about 3 millimeters. Now I'm going to take the probe measurements for the following teeth: 8 lingual, 14 buccal, 24 facial, and 30 lingual. As I'm doing this, I am ensuring to do short walking strokes, and when I reach the call area, I'm angling the probe and making sure that I am able to adapt enough to reach into that call area. As well as I'm doing this, I am checking for any bleeding or separation and making sure to take any note if that happens on any of these surfaces. To determine measurements, as I'm taking walking strokes, I am recording the deepest reading per area, and then I will round up the measurement to the nearest whole number. My measurements are as follows: 8 lingual, 223, 14 buccal, 344, 24 facial, 222, and 30 lingual, 323. Next, I will be determining mobility by using 2 instruments with blunt ends, taking them on both sides of the tooth and rocking the tooth horizontally to determine any mobility. I'm determining that this is about a class 1 mobility. The classes are as follows. Class 1 is less than 1 millimeter of horizontal movement. Class 2 is greater than 1 millimeter of horizontal movement. And class 3 is also greater than 1 millimeter of horizontal movement, but there's also vertical movement, where if you press down on top of the tooth, it will press into the alveolar bone. Okay. Next, I am taking note of tooth 14 because there is quite a bit of recession and there could be furcation involvement. I do not have a neighbor's probe, but if I did, I would take that and slide it into the vocation to determine what class it is. My best guess here is that it's about a class 2. Next, I'm going to be looking for any open contacts. To do this, I will take dental floss and put it in the interproximal areas to feel any looseness. This could mean there is an open contact in which food, debris can be easily impacted.
Just to like check.
So taking notes, and after I do this, I will maintain asepsis and my probing skill assessment is complete.